We are going to give it just a couple of minutes before I get started, and I will introduce myself. But in the meantime, everybody is welcome to say hello in the chat. Let me know where you're from, what your background is. Today is a free course that we're putting on as part of our MyoMentor training programs. And my name is Sarah Hornsby. And again, I'm going to be introducing myself very soon. I'm also very aware that with Zoom, it takes a couple of minutes for everybody to get into the room to feel like they actually know what's going on. And so I like to start the presentation after just a minute or two. So like I said, say hello in the chat. If anybody does have questions, we will be doing a Q&A segment at the end. So please feel free to post your questions in the Q&A box. Please, if you want to ask anything, let us know and we will. My plan is to have this presentation go for about 1 hour. And at the end, I'm going to bring on a couple of our MyoMentor team members and we'll answer your questions. This is a free course. It's designed to be informational, whether you are a patient or you are a practitioner, a hygienist, a dentist, a speech pathologist. This course is meant to help all of you get some free information that I'm hoping you can pass on to your patients, to your family members, just for your own knowledge or whatever that may be. So I think we're 2 minutes in. So what I'm going to do is officially start the presentation and share my screen and we'll get going. So by the way, I just want to check the chat. Okay, we've got Melanie from Utah, we've got someone from South Africa. That's impressive. We've got a hygienist from Edinburgh. Amazing. We've got what else? Someone from California. Awesome. I don't know if anyone's from Scottsdale, Arizona, or from Arizona in general. That's where I live. That's where I am today. And we are into our summer heat. So I think every day this week it's been over 110. And man, it's a whole different, I forget every year that it gets that hot. So here we are. All right, I am going to share my screen and then I'll ask for some feedback on whether or not you can actually see. Oh, wow, we've got someone from Dubai. That's incredible. Welcome, Calgary, Canada. Amazing. I'm so happy that you're all here because you're interested in learning about myofunctional therapy. So let's get started. Here we go. All right, so please give me some feedback. Let me know in the chat if you can see my screen and you see the presentation on ready to go. It's always really helpful for me to get that feedback. Let's see. Awesome. Okay, thank you, everyone. I'm glad you can see. So today we are talking about myofunctional therapy, and this is your crash course. So if you don't know anything about myofunctional therapy, this is an introduction to the field. It's an introduction to what these symptoms are all about. It's basically like a myofunctional therapy 101. It's laying the foundation for a lot of advanced concepts that I think whether you're a professional, a parent, or just a person trying to learn more about their own symptoms, this is going to be a great course for you to take over the next hour. All right, I do have some disclosures in case anybody's using this for CE. In our professional worlds, we need to have disclosures. So I'm currently paid, or I have been a paid lecturer for the following organizations: Spear Education, the Breathe Institute, the Academy of Orofacial Myofunctional Therapy, the International Association of Orofacial Myology, MyoMunchie, MyoFocus, the American Laser Study Club, Light Scalpel, and the AAPMD, or American Academy of Physiological Medicine and Dentistry. That is a mouthful. And I also have to tell you that all the images here are not altered or misrepresented or falsified in any way. So again, if you're using this as part of a lunch and learn for CE purposes, now you are official. All right. Before we move on too far, I just want to introduce myself. I know maybe a lot of you have seen my YouTube videos or you've checked out my webpage, but my name is Sarah Hornsby, and I do have to say, technically, my name is Sarah Bauman. I've been married for several years now, but professionally, everyone knows me by Sarah Hornsby, so that's how I'm introducing myself to all of you. I am originally a dental hygienist. That's my training and my background. I graduated from Eastern Washington University in 2008 with a bachelor's degree, and I was practicing for only a couple of years before I started to look into other things that I wanted to explore. So I sort of accidentally stumbled upon this course in myofunctional therapy. when I was looking for CE. So I needed some CE credits for my license. And I thought, wow, this class allows me to take a weekend course and I can get all my credits at once. So I have no idea what it's all about, but I'm going to go give it a try. So that's where I got my initial myofunctional therapy training in 2010. And I can tell you, oh my gosh, the world is so different between technology and advances in the field and the research that we have today compared to 15 years ago. It's pretty incredible. So I feel like I haven't been practicing for that long. I've been practicing for 15 years, but it's like a lifetime of change. So I just want to let you know about that. I opened up my practice called Faceology in 2010, and I was seeing patients out of my office in Seattle. And then I made an interesting change around 2014. I started to see patients exclusively online. And so that was way before the pandemic or COVID or anything like that. And people thought I was crazy, but I was working in Seattle, a very tech centric, tech forward part of the world. And my patients were asking me, can I meet with you on Skype? If anyone remembers that from back in the day, can I meet with you on FaceTime? And I was reluctant, but I thought, maybe this is the future, and it can, we got a lot of traffic here in Seattle. Maybe this is a way that I could start seeing patients. So started seeing patients online in 2014. And I also began a mentoring program around that time because other hygienists and dentists were asking me about this strange therapy I was doing. And they were asking me about how I got trained and what does my practice look like. So I started a little mentoring program that's grown into the training course that I teach today called Myo Mentor. So I've also had the incredible opportunity of speaking and lecturing internationally and nationally, like all over the place. Which, if you asked me in 2010 if I ever thought that would happen, I would have never, ever guessed that people would be asking me to talk about myofunctional therapy in Japan or in Australia or in, all over the US. So it's been a pretty amazing experience over these past 15 years. But at the end of the day, I will tell you the reason I really got into this field and stuck with it, even through the early days when nobody knew what it was because I discovered that I had my own myofunctional symptoms. And so I was in that very first training course, and I was really, I had a couple of feelings. I felt in denial was one, like, no way, I can't have these symptoms. I'm a hygienist and I've been to all these amazing CE courses and I'm a new grad. I should have all the latest and greatest information. But I felt like a rug or a carpet had been pulled out from under me. And I thought, how did I end up with myofunctional symptoms? And nobody ever told me. My pediatrician, my childhood dentist, my orthodontist, my current dentist, my current boss, like, why had no one ever told me that I had a low tongue posture or a tongue thrust, or that sometimes my mouth was open or that I was mouth breathing? And so it kind of rocked my world. And I thought, I am a professional, I'm a dental professional. What about people who don't even have that as their background? How do they know about these symptoms? And so that is what led me to pursue everything that I do today. So that's my background. Like I said, I was married recently. I went from a world traveling entrepreneur to all of a sudden a mom, a stepmom. And so I got to now I have two incredible stepchildren, Gloria and Sebastian, and my husband Peter is here too. This picture is actually like 3 years old. So I feel like they've grown a ton since then. But I came into a family and I discovered all of them also have myofunctional issues. So these problems are so common and they are so just considered to be normal in our lives, in our families, in our practices that we don't even think of it as that strange. Like we're just so used to seeing these symptoms that they're everywhere and we totally miss it. So I've had a whole new perspective working on my own family with these things compared to just myself. And I will tell you that working with your family is the hardest, the hardest of all. All right, this is my training organization, Mile Mentor. We offer a 12-week program. I'll talk about more at the end, but we do a training course in myofunctional therapy. We have a business course. We have an orthodontic course. I'm proud to say in the past 10 years, or 11 years technically, we now have over 1,800 graduates. 300 of those are dentists. There's 50 or more speech pathologists, and we represent at least 20 countries around the world, which is pretty amazing. So we've grown this incredible community that I'm super proud of, and that we are always working on supporting, on making better, and really providing all that we can to all of the students and graduates so that they can go out and help more patients. So it's not just all about me these days. It's me treating patients. It's now about helping all of my graduates help as many patients as possible. So that's why we're all here. All right. So who is this course for? Why are you here? So this course today, it might be for if you're a patient and you found this online and you want to learn more about your symptoms, this course is for you. If you're a dentist and you're hearing a lot about myofunctional therapy and your patients are asking about tongue ties or mouth breathing, this course is for you. If you're a hygienist or a speech pathologist interested in potentially getting trained in this and you're trying to learn more, then this course is for you too. So really, this is for anyone. This is also a course that I'm putting together, hoping that my graduates have a new tool, a new resource that they can now take this presentation. We'll be posting this online. And now they can share this with either their patients or maybe their colleagues who don't know what myofunctional therapy is. So this is all about getting the information out there. And it's really, I will say it's designed more from a dental professional perspective, but I think I keep the concept simple enough that I think anybody from anywhere can follow along and understand what we're talking about. All right, so here's what we're going to be covering today. We've got an overview and an introduction to the field of myofunctional therapy. We've got, I'm going to be talking about how to understand symptoms, so how to identify orofacial myofunctional symptoms. We'll be talking about the 4 goals that we have for all of our patients. And we'll be talking about how these myofunctional symptoms connect to these bigger problems that we're trying to help our patients with in the dental world specifically. Sleep disordered breathing, sleep in general, TMD issues, or jaw pain, clenching, grinding, all of these things. And I'm really big on research, so I'm going to be talking about the latest research that supports all of the things we're talking about today. Again, I'll just put it out there. Oh, Daisy, you say you're a fellow EWU grad. Awesome. I'm just going to put it out there. If you do have questions, please post them in the Q&A box so I don't miss them. If you put them in the chat, I won't be able to find them later. Also, at the end, I am going to have a couple of my team members come on, and we will spend, the lecture will be about an hour. I expect it to end at 11:30 Pacific time. And then we'll spend maybe 15 to 30 minutes just answering any questions that any of you have. So just to give you a heads up. All right, so let's just start with the basics. What is myofunctional therapy? So if you're Googling, if you're researching online, if you're typing this into ChatGPT, you're going to see multiple words come up. Orofacial myofunctional therapy is technically the correct term, but it is a very long word and it's a mouthful. So we tend to shorten it as just myo or myofunctional therapy. You might see the word orofacial myology. A lot of people refer to that as the overarching science or the field. Some people even call themselves an orofacial myologist. I find that's more of an outdated term, an older term, although it's still around. You might hear people call it tongue thrust therapy. Again, I think that's a little outdated. We try not to consider everything that we do as just fixing a tongue thrust, which we'll get into. But think of this field as something that's similar to physical therapy. So we teach our patients exercises. Our exercises just focus around the tongue and the lips and the cheeks and basically the entire head and neck area. So at the end of the day, we teach people exercises, and these exercises help with very specific things I'm going to be getting into as we go through this lecture. But before we get too far, people always want to see videos. So what are these exercises? What do they look like? I'm going to share 3 examples with all of you here today. These are very simple exercises. They do help with a lot of bigger things we'll be covering, but let's just watch a few. They are set to music and we'll see if that comes through, but here we go. Just gonna turn it down and talk over it. So the first exercise is called TikToks, and literally all she's doing is clicking her tongue and moving her cheeks and lips. So it makes a click, clock, click, clock. It sounds like a TikTok. So again, very simple. This helps with so many things. We teach it to every single patient out there. And that's what we're showing today. Let me go to the next one. All right, this is the one elastic hold. Again, we do this with every patient. We want them to take an orthodontic elastic band, place it on the tip of their tongue, and put their tongue up to the palate or spot area. And it's very simple. It's a habit and awareness exercise. I would not recommend using like a hair tie or any sort of non-dental elastic. Make sure if you're going to do this at home that you have something that can actually go in your mouth. All right, the last exercise is cheek puffs. And this is left and right. We have other versions of cheek puffs, but for this one, she's just puffing her cheeks full of air and she's moving the air to the left, counting to 3, and then moving it to the right and going back and forth, doing this repetitively. This one, actually, you'll feel it quite a bit if you do it for an extended period of time. A lot of these exercises, they seem overly simple, and in theory they are. In reality, I mean, they're very simple in concept, and when you watch somebody on a video like this, it's super simple. And patients and providers say to me all the time, can't I just Google the, can I just use videos like this? Can't I just do my own therapy if I look on YouTube or Instagram or TikTok? And I say, yes, you could. Technically you could, but there's a big difference between watching a video and actually having the guidance of a real therapist helping you with your unique compensation patterns and your unique challenges. So you can watch a video and try your best to imitate it, but a therapist is going to be the one saying, okay, you're using too much of your jaw, you're using too much of your neck. Let's get in a better full body head neck alignment posture. And so that's really the importance of working with someone in person. But yes, if you just want to try to do some DIY, there's tons of resources out there where you can definitely send your patients or go yourself and check out. There's a lot of information, but I can't guarantee that you'll get much result from it, if that makes sense. All right, let's keep going. So in this field and as part of this therapy, we've got 4 really simple goals, and this is what we're going to be breaking down today. So we need all of our patients to be breathing through their nose all day and all night. That's it. We need all of our patients to have the lips together in a lip seal. All day, all night. That means the lips need to be touching, and at rest, they need to be touching. They shouldn't be open or apart. We need all of our patients to have high tongue posture. That means the tongue needs to be up in the roof of the mouth all day and all night, and they need to be swallowing correctly, which actually happens when you have the good posture. We do teach specific swallowing exercises, but most of this all comes from having the correct posture, and then your swallowing kind of falls in line. So all of these goals are really the point of the therapy. So if someone comes and works with me, this is what I'm going to tell them. By the end of our sessions together, I need you to be doing all of these things all day and all night. And this is in order to restore normal function. So our normal, natural, healthy state is to be breathing through the nose with our lips together, with our tongue in the top of our mouth and swallowing correctly. We shouldn't need a therapist to help us with this. We shouldn't need a person, we shouldn't need to watch videos online. We shouldn't really even be thinking about any of these, except that if we are, something's gone wrong. And I'm going to get into more of, how or why. But of course, this doesn't include when we're eating, drinking, speaking. But if we can accomplish these 4 goals and we're children or, toddlers, especially if we can do it from the time we're born, we can get all of these things working properly. We can literally guide the growth of children's faces, their airways, their dental and jaw and facial development, because this is our normal, natural, healthy state to be doing these things. So a lot of people aren't doing those things, myself included. I discovered when I first was in that very first training course that I took in 2010, I discovered I did not have all this stuff going on. So it's very common. Part of the reason it's so common is because we see little boys like this in this picture, and they're everywhere. So many kids have their mouth open. So many kids are mouth breathing. We kind of see this as normal, and it doesn't set off a red flag in our head like, oh, that child's mouth breathing, what's wrong? We need to start looking at this through the lens of dysfunction. When we see kids, their mouths are open, their mouth breathing, we have to start asking, what's happening? Why are they doing that? That's not our body's normal, natural, healthy state to be in. So we have to start asking what's gone wrong. Maybe this child has chronic nasal congestion. Maybe they have allergies. Maybe they have giant tonsils and adenoids that are blocking up their ability to breathe through their nose. Maybe they're tongue tied, and so their tongue is having a hard time going up, and therefore their mouth rests open. So these are all reasons that you could be mouth breathing or have your mouth open. We'll be dissecting a little bit more throughout this program. But the point is that we need to correct these habits in order to address some of the other bigger problems that can stem from them. So we really want the tongue up, the lips together, and the nasal breathing to take place as early as possible so that we can get optimal cranial, facial, and airway growth and development. So hopefully that all makes sense. I know it's a lot of information, and if you do have questions, don't forget you can post anything in the Q&A box, and we'll get to those at the end. All right, so what problems does it lead to? Well, all of these bigger issues that we see in our adult patients every day stem from this poor orofacial growth and development. So we get an increased risk for dental problems, that's periodontal disease, tooth decay, clenching and grinding. We get an increased risk for sleep apnea, snoring, and sleep disordered breathing. And our patients who are in chronic pain because of that clenching and grinding, the TMJ issues, headaches, facial pain, head neck pain, a lot of that can stem from these underlying myofunctional problems that were never addressed years and years before. So, did you know that tongue tied or mouth breathing children are very likely to end up as adults with sleep disordered breathing and temporomandibular joint disorders? So, I have that little blurb at the bottom. It is, I almost think now, obviously, this is my world, this is what I do, but I see all of these myofunctional issues that seem so simple and so harmful, like harmless. It seems like, well, why does mouth breathing really matter? But if you start to see the growth trajectory and the dysfunction that we have with these soft tissues and our breathing, it kind of makes sense that if you have that for decades, that you can end up as an adult with much bigger issues. Okay, so I know we're talking about myofunctional therapy, but what's really happened over the past, I would say, 8 to 10 years is the focus has shifted from just tongue posture and lip seal and nasal breathing to really looking at the airway and breathing development. And the tongue is a big part of the airway. So I like to show this slide to all of my patients because I think it's such a good visual. The tongue is that big gray round ball in the picture, and it's literally filling up all the space within the oral cavity. And if your tongue's not in the correct place, if it drops down from the palate, now it's not filling up all that space. Now it's kind of trying to figure out where to go. So it's going to either push forward and have an impact on the teeth. It's going to rest backwards and have an impact on the breathing and the airway. And so when we're talking about these concepts with our patients, what we're really trying to help them see is this bigger picture of breathing and full body health, and how do we get, proper tongue posture and nasal breathing so that we can have benefits in all these other bigger, more important areas of our lives. All right. Well, if you're like me, sometimes you get curious, like, where did this come from? Why am I just hearing about this now? Is this like a new fad? Is this like a new TikTok craze? What's what's going on? But this is actually, we've been talking about this for a while. So I went back and I did some digging on, the origins of talking about some of these breathing issues. And I think it's really fascinating. And so I'm going to share with all of you what I was able to find. So in the 1800s, there's this guy, George Catlin, and he wrote a book called Shut Your Mouth and Save Your Life, which is fascinating. It's one of the first print records that we have of somebody talking about the difference between mouth breathing and nasal breathing. And basically what he did is he went around between the 1830s and the 1860s, and he lived with different tribes in North America, South America, and Central America. And he observed that these populations of people were all super healthy. They all had really wide palates, straight teeth, symmetrical faces. He even noticed that they had lower rates of infant mortality. They had lower rates of death and disease overall. And he identified that they were all nasal breathers. They were not mouth breathers. And so if you think about what was happening in the 1800s, this was during the Industrial Revolution. So if you lived in a big city back in those days, it was probably super polluted, and it was probably causing, between the air and like the lack of like sewage systems and things like that, it probably was causing more people to have breathing issues, to be more sick, and potentially to be breathing through their mouths more. So if that's what he was comparing it to, it starts to make sense. I mean, think about like the factories and the industry and the I don't know, just all of the pollution that was happening at the time, with no real understanding of what that was doing to our health. It makes sense. So it's pretty interesting as well. All right. So in his book, he has these pictures that are kind of hilarious. I mean, I feel bad. These people, the drawings are like, they're hideous, right? They don't. And so he's saying that on one side is nature, how nature intended our bodies to grow and to look. And then on the other side are these people that look crazy. And it says this is changed by habit. And so there's all sorts of pictures. I'll show you a few more, but he's quoted with saying, mouth breathing is dangerous to health. And he said, the cause of modern man's maladies is lack of quiet and natural sleep. Proper breathing regulates digestion and circulation to every part of the body. Improper breathing brings imbalance and disease, and the nostrils are intended to temper the air and support proper breathing. Now, think about what we knew about health and the body in the 1800s. So, he actually made some really great observations. And I think what he was looking at was actually sleep apnea and snoring. And he didn't really realize what he was seeing, but he talks about mouth breathing at night. In general, he has this quote, that man knows not the pleasure of sleep. He rises in the morning more fatigued than when he retired to rest, takes pills and remedies through the day, and renews his disease every night. He has pictures there, and he said that only sick horses breathe through their mouth. That's like a sign when a farm animal has something wrong with it. It starts to breathe with its mouth open. And he's got, again, all these hideous pictures of people mouth breathing and what happens to their face and their teeth. It's pretty fascinating. So he was identifying this in the 1800s. And if you're in the dental profession, you know who Dr. Edward Engel is. He is the dentist who is responsible for coming up with our Engel's classification of malocclusion. So when you hear dentists talking about, oh, that's a class 1, a class 2, a class 3, underbite versus overbite, things like that, he is the man who designed this. And the fascinating thing, again, for all of us dental people, is that he was actually influenced by this George Catlin guy. And so he's quoted saying, we are just beginning to realize how common and varied are the vicious habits of the lips and tongue, how powerful and persistent they are in causing and maintaining malocclusion, how difficult they are to overcome, and how hopeless is success in treatment unless they're overcome. So it's fascinating. He's talking about the lips, the tongue, all these soft tissues, and how they really have quite a big influence on our dental structures and our jaws and our overall just facial structures. So, all right, well, today we've come a long way, and now we have social media. And so, what's really fascinating to me is how much this has exploded on platforms like YouTube, TikTok, and Instagram with these little video shorts. So I found 3 I'm going to share with you today. The first one is of me. I did not make this. I mean, this is an old video that I made, I don't know, 10 years ago. It was probably from 2017, I'm guessing. So not quite 10, 8 years ago. And so I'll play this one in the middle first because it actually is me, but somebody took it, chopped it up, and spread it all over TikTok. So here we go.
This is your mouth. I want your tongue resting, making all of these points of contact across your upper jaw. So your tongue, the tip of it needs to be here, which is behind your upper front teeth. The middle and the back need to be making those other 2 points of contact. If your tongue rests in the bottom of your mouth, you've got to get it up here. But no matter what, all the time when you're not speaking and when you're not eating, your lips are together, you're breathing through your nose, and your tongue is fully contained in the roof of your mouth, making contact from the very tip to the very back.
So again, it's funny to see me 7 years ago. Somebody took that video and made it. If anybody's heard about mewing, this is also a popular trend. This woman's talking about it. Mewing is all over the place, especially with young boys. And all the concepts, the myofunctional concepts, the viewers have taken and kind of put a new spin on it. So,
My feed has been
oh,
flooded with mouth breathers.
sorry, wrong one. I want to do this one.
Fun mom, connect with your teenager and ask them if they've heard about the new viral sensation mewing that is infiltrating the public school classrooms. Have you heard of it? It's a quick fix, non-surgical beauty trend that supposedly makes the jawline more defined by pushing your tongue to the roof of your mouth in an attempt to define your jaw, originating from a controversial orthodontist, John Mew. Seemingly more popular among boys and wouldn't be that big of a deal, except that when their teachers call on them, they just go shh and point to their jaw and let them know that they can't stop mewing in order to answer the question that's being asked of them. It's viewed as disrespectful and rude, which rightly so, when done seriously to a teacher, parent, or peer trying to connect. But besides that, I think it's kind of funny. And hey, I'm a big fan of facial yoga as opposed to fillers, especially for teens. Tell your kids about the 90s trend, talk to the hand, and see if they think it's familiar. Ask how they would feel if somebody did that to them. Funny or disrespectful?
Mhm. So again, she's talking about mewing, getting your tongue up to the roof of your mouth. Let's watch this last video that started by accident. Try to reverse it. Here we go. Again, talking about all these
My feed
concepts.
has been flooded with mouth breathers, taping their mouths shut at night to go to sleep. But is breathing through your mouth really that bad? More than 60% of adults are breathing through their mouth too often. And that can lead to loads of issues like poor sleep, tooth decay, jaw misalignment, bad breath, and even some learning difficulties. But why is breathing through your nose so much better? Well, for starters, your nose is a natural filter. It traps dust and other particles in its hair and its mucus. Then there's your sinuses, which are spaces that swirl air around and produce nitric oxide, which kills bacteria and viruses, and it also relaxes the blood vessels in the respiratory tract, which means that more oxygen can pass into the blood. Research does show that breathing through your nose boosts brain function. Studies in rats show that young mouth breathers took longer to solve mazes, and then in the adults, they had fewer neurons in the hippocampus, which is the area associated with learning and memory. Even in humans, we perform better on memory tests when we're breathing through our nose. But if you're a mouth breather, what can you actually do about it? Mouth tape might not be the option. There's only one small study that shows that it reduces snoring and daytime sleepiness. Instead, you might want to set alarms throughout the day that remind you to breathe through your nose. Or if you hum regularly, it increases airflow into your sinuses and actually boosts nitric oxide production by up to 15 times.
So again, these are just like a small, like I went on and these were the first things that came up. And just to share them with all of you, especially if you're a dental provider or a speech therapist, uh, patients are going to come to you asking about these things. And I think we have to be prepared for that. So people are finding so much information online that it's almost like forcing us to keep up with it and learn these concepts. So everything that's talked about in these videos are things that I talk about to my patients and in my courses and pretty much every day. And now it's all over the internet, which I think is amazing. There's so much more access to information now that it's helping move the field forward.
Fun mom.
This is
Okay, here we go. We also have research, and I actually like citing this study because it's 15 years old now. I didn't know about it at the time when I first started getting into the field, but there's a huge crossover that we're starting to understand. And actually, it's very established in more recent articles I'm going to share with you. But this is from General Dentistry in 2010. And I'll just read the quotes I pulled from the article. Children whose mouth breathing is untreated may develop long, narrow faces, narrow mouths, high palatal vaults, dental malocclusion, gummy smiles, and many other unattractive facial features, such as skeletal class 2 or class 3 facial profiles. That's an overbite or underbite. These children do not sleep well at night due to obstructed airways. This lack of sleep can adversely affect their growth and academic performance. Many of these children are misdiagnosed with attention deficit disorder, ADD, and hyperactivity. If mouth breathing is treated early, its negative effect on facial and dental development and the medical and social problems associated with it can be reduced or averted. So it's fascinating to me. So many of these myofunctional breathing issues can lead to what looks like ADD or ADHD and can contribute significantly to it as well. And so it's good for, I think every parent should know this. If your child's not breathing well and they're not sleeping well, they can have an impact. It can have an impact on their brain. This is from 2010. Now I have a more up-to-date article that elaborates on this, and it's a much bigger study, 10,000 kids. And it talks about changes to the gray matter of the brain from mouth breathing. And so it talks about mouth breathing at night, noisy breathing, and snoring, not actually sleep apnea, which is a whole bigger, much more complicated breathing issue. But this is just mouth breathing at night, snoring, and noisy breathing. And it says they can see changes to the areas of the brain involved in muscle control, sensory perception, hearing, memory, emotion, speech, decision making, and self control. And so this article says this explains why children with snoring issues may have problems with aggression, emotional regulation, ADHD, among other behavioral and learning issues. So we've known about this for a long time. This article is from 2021, I believe. I don't see the date on there. But this is something that I think the public needs to know about. Us as healthcare professionals need to know about these breathing issues. It sounds so silly and so simple, but they actually have a big impact on children and adults in many ways. We're just more worried about kids' brains when they're growing and developing. It still has the same effect on our brains as adults, but it just manifests a little differently. All right, so let's talk about how we identify these myofunctional symptoms so that we can start helping our patients, ourselves, our family, our friends. Let's start looking for these 4 symptoms that oppose the 4 goals. So we are looking for tongue thrust swallowing patterns in our patients. We're looking for low tongue posture, mouth breathing, and open mouth posture. And I'm going to break each one of these down individually. If you're listening, you can start to really try to gain awareness in your own mouth about your own habits, postures. I will tell you, most of us are in denial in the beginning, like, I don't mouth breathe, I don't do that. It's very, very common. So it does take a degree of self awareness as you're learning these things to reflect in yourself, but also keep in mind that if you're talking to patients in your practice about these things, most people will tell you they don't have any of this stuff. They'll say, no, I never breathe through my mouth. But these are how we identify the patients who need therapy. So if anybody's doing any of these, you know automatically that you can refer them to work with a myofunctional therapist, or you can get training in it yourself and learn how to treat that. Okay, so we'll start with the tongue thrust. What is that? Well, a tongue thrust swallowing pattern, it's more of a symptom. So it's not really a diagnosis of anything, but it's a dysfunctional swallowing pattern that we can see when the tongue pushes forward against the front teeth or it pushes out laterally towards the molars or premolars. So we also see contraction of the facial muscles. So you might see a dimpling mentalis, the lips pursing, the cheeks or buccinator muscles are really overactive. And so we're not only concerned with what's happening with the tongue, but what's happening with the facial muscles on the outside. This is a compensation pattern for having poor tongue tone or maybe a tongue tie or for having mouth breathing. So the body's trying to figure out how to swallow when your tongue can't move well and when you can't breathe well. So it's just a compensatory problem. And I will be honest, only about 10% of patients, in my opinion, actually relate to this. The majority, 90% of patients, they're not really going to understand what you're talking about. But the 10% who get it will tell you, I do that. It drives me crazy. I don't like it. I can't change it. But most patients won't relate to this. So I try to focus on our other areas more so than this one. I do have a video. This video is like 10 years old, maybe 12 years old at this point. It's on YouTube still. It's on my YouTube channel. And it's basically a bunch of people swallowing with cheek retractors in, swallowing with a tongue thrust swallowing pattern set to music. It's super weird. I don't know why it has so many views. I'm just going to play a couple seconds of it so you can get the idea. What does a tongue thrust swallowing pattern look like? Again, this is old. It's kind of cringy for me when I watch it, but it is helpful to visualize what we're talking about. Okay, I'm going to skip ahead. So here we go. We've got cheek retractors in. The patients are trying to swallow. Their tongue is pushing and all their facial muscles are activating. And that's what we're looking at. See another, again, the tongue is thrusting forward. The cheeks are really working hard. Kind of a silly video, but we'll do this one last one. Tongue's pushing, face and lips are cheeks are really struggling to swallow. So if you really want to watch the full video, this is on my YouTube channel. You're welcome to go back, but it's a good demonstration. All right, let's switch gears and talk about low tongue posture. So if you're sitting here thinking, well, how aren't all these things happening at the same time? You are right, they are. I've just broken them up into separate segments so that we can talk about it for educational purposes. Um, so what is low tongue posture? Well, we're really more focused on the back of the tongue than the front. So we need the front up, but the picture on the left is correct. So the entire tongue is touching the entire roof of the mouth. Like I said in that video of the, I think it's an MRI or CBCT image, where the tongue is the big gray ball. So the entire space of your mouth should be filled up by your tongue. Okay, so it shouldn't just be like the tip of the tongue is up and the back is swaying down like the picture on the right. This is the first step a lot of people take, and they think their tongue is up, but it is not because the back is still low. All right, here's another different visual. This is a cross section of the jaws. And on the left side, we have picture A. That's correct. The tongue kind of needs to be tall. And again, filling up that whole space. You shouldn't be like the picture B, where there's a gap of air between the top of your tongue and the top of your mouth. There shouldn't really be that extra space. The tongue needs to be filling up that space. Okay, next is a CBCT image showing a picture of somebody with low tongue posture. You can see it right here. This isn't necessarily a tool that I would use to assess or diagnose for low tongue posture, but if you see it on one of these images in your dental office, at least it's a conversation starter. You can bring it up. But what problems are associated with this low tongue posture? It's really detrimental to the teeth. So this is where we see that spaces can become difficult to close for the orthodontist. The bite might be difficult to close and to get into that correct occlusion. You're more likely to have orthodontic relapse. You're more likely to have kind of that high, narrow, vaulted palate. And when the tongue is in the bottom of the mouth also, it's more likely to fall back into your airway or your throat and make you snore or develop sleep apnea at some point. So there's a direct impact on our the dentition and our occlusion, and there's also an impact on our breathing at night and during the day. Okay, this is really cool. This is from a study in 2011, and it talks about that from the time we are born, our tongues should form this perfect suction cup of negative pressure where between the soft palate in the back, the lips on the front, and the cheeks on the sides, the tongue should be able to suction perfectly in the top of our mouth and stay there all night while we sleep. So I get people asking me all the time, like, I can do this during the day, but it's impossible to keep your tongue up at night when you fall asleep. That's just not going to happen. And the thing is, it actually should happen. So in the picture on the left, you can see a young kid. I can't quite tell the age, but the kid is asleep, and you can tell that their tongue is forming a little suction. And so you pull down the jaw. You can see this in infants. It's really incredible. But unfortunately, what happens somewhere along the way is we develop a cold, a breathing issue, an allergy, or we have a tongue tie. And this perfect design is disrupted by either our tongue physically can't make the suction cup, or we need our mouth for breathing because our nose is congested. And so if this is disrupted at an early age, you learn the low tongue posture, you learn mouth breathing, and now you grow into an adult in that dysfunctional posture and breathing pattern. And now it's actually having an impact on the shape of your jaws and the shape of your face and airway as you grow, which is pretty fascinating. So here is the ideal tongue posture. This is the roof of the mouth. Looking at the top of the mouth. Oops, let me go back. And your tongue should be, the tip of the tongue should be here, and then the middle and the back need to touch. So we call this first area the spot, and that's kind of the target for the tip of the tongue. And then the second goal is to get the back of the tongue to rest at the top as well. All right, I'll move on to this picture. I pulled this, I found it on Instagram. I thought it was just a great visual from Archway Orofacial. And so on the left, we've got a super narrow palate. I mean, this is like an extreme narrow palate, but there is a problem. I mean, I look at that and I can tell that person's tongue has never been up in the roof of the mouth. That mouth, that palate has not been shaped by the tongue at all. And in an ideal world, if your tongue is up, the shape of your jaw is going to mold and be formed around that tongue. So that's where I got this Instagram post. It says, when the tongue rests on the roof of the mouth, it provides internal support and guidance for palatal development. This means that the constant pressure from the tongue resting on the palate encourages forward and lateral growth. This also means that when the tongue posture is low, we tend to see restricted growth and vertical growth patterns, and this leads to narrow, vaulted palates. Pretty interesting. All right, let's keep going. So then we have to ask, why is the tongue low? There's usually just two reasons, and you have to figure out with either yourself or your patients, what is the reason? Well, it's either a nose problem, meaning we can't breathe through the nose, or there's some sort of sinus issue, tonsil issue, so nasal breathing is difficult. And two, there's a tongue problem. So we're not going to go in depth into tongue ties today, but I will tell you that in my education as a dental hygienist, I learned that only this bottom picture was a tongue tie. And that is like an extreme, extreme tongue tie. I mean, the tip of the tongue is fully connected to the floor of the mouth. We don't actually see that very often. What we are more likely to see is patients like these two patients, where they do have a tongue tie, if you know what you're looking for, if you're using our modern grading scales that I'm going to talk about in a minute. Both of those patients are also tongue tied. The person on the left is the one that's considered to be normal here. Okay, so I'm going to just do a quick little intro to tongue tie grading because it has evolved and changed over the years. But I think this is a great start. This is Dr. Richard Baxter. He wrote the book Tongue Tied. He is a colleague and a friend of mine. He's even a MyoMentor grad. He's gone through my course. I've gone through his course as well. And so when people are asking, well, what is a tongue tie? You might hear us talk about it as like a minor midline birth defect. It's really an embryological remnant of tissue at the midline on the bottom of the tongue, and it connects the tongue to the floor of the mouth. And in some people, it's too short, too tight. It's not functional. It's usually associated with breastfeeding issues, and it's discussed as a problem for babies. But we're learning more and more, and we've got so much research now that's saying this is not only a problem for babies, this is also a problem for children and adults. And if you're tongue-tied, you are more likely to develop sleep apnea. So good to know. Here is that modern grading scale that I'm talking about. So on the left, this was only published in 2017, and we call this our TRMR grading scale. Again, I'm not going to get super in depth, but if you look at all four of those images on the top, and I should say the second one was published in 2021. So these are newer grading scales. You probably, unless you went to school, actually, I don't even know if this is in any textbooks for dental schools or orthodontic schools or hygiene schools. I'm not sure if it's made it that far. It takes time for these things to get fully integrated into our educational system. But the people on the top are within normal range. So they're grade 1, grade 2 on the top. If you are, and especially let's just focus on the squares on the left, the TRMR TIP. If you're in the bottom two squares, if you're a grade 3 or grade 4, you are not able to put your tongue on the roof of your mouth. There's no way. You are going to really struggle. So those patients need tongue tie surgery to release their frenum in order to accomplish the 4 goals of therapy. So there are some patients that we see, we're like, uh-oh, there's no way you can physically do what I need you to do so that you have good oral function and oral development. You need a surgery as part of your process. So that's where, if you're hearing a lot about tongue ties, this is where it's coming from. We're learning that not all tongue ties look like the tip of the tongue fully connected to the floor of the mouth. There is a full range beyond that of people that actually do have some frenum restriction. All right, let's switch gears and talk about mouth breathing. Mouth breathing it really, I think, especially in kids, but adults as well, it really becomes a quality of life issue, because what happens is when you're not sleeping well, when you're not breathing well, you're not sleeping well. And when you're not sleeping well, you're not growing well. You're not going to be able to learn very well in school. You're not going to be able to focus. And so it really has a much bigger impact on us physically, psychologically, physiologically than I think most of us think about. So nasal breathing is our natural state. That's what our bodies are designed to do. And like I said previously, the children who mouth breathe will become the adults we see with bigger problems like sleep apnea, clenching and grinding, and snoring. A lot of these concepts, if you want to do a little bit more exploring, the Buteyko breathing method talks a ton about breathing and our nervous system. And so I pulled some information from that. So mouth breathing activates our body's fight or flight or stress response, our nervous system response, our sympathetic nervous system response that puts us in that fight or flight mode. Whereas nasal breathing activates our body's rest and digest, or our parasympathetic nervous system response. So ideally, we're not in this like stress mode all day. We're not in fight or flight mode all day. And also think about this for night. If you're mouth breathing all night and your body's in fight or flight mode, you're not going to get very good sleep. So even just changing from mouth breathing at night to nose breathing at night, your sleep will dramatically improve. So mouth breathing also activates our upper chest, and it's shallow breathing. Nasal breathing activates the lower third of our lungs and our deeper breathing. So it's really, really important. There's tons of information on this. Look up any book by Patrick McKeown if you want to learn more about Buteyko breathing. He also wrote a book called The Oxygen Advantage that I think is really helpful. All right, there's also an interesting thing that happens with CO2. We tend to think of CO2 as just this waste gas, like that we breathe it out, we exhale it, it doesn't matter. But CO2 actually has to accumulate to a certain degree in our bodies in order for our respiratory system to be able to utilize oxygen to its full potential. So basically, when you're mouth breathing, you're blowing out too much CO2. It's not able to accumulate in your system, and you're not able to utilize those oxygen molecules as well as we should. So a lot of times when we switch from mouth breathing to nose breathing, we feel like we can't breathe. We're panicky, even if we have a clear nose and no congestion. And that's because as the CO2 is increasing in our system, it's really uncomfortable. So a lot of what we're doing when we're teaching our patients to nasal breathe is we're increasing their CO2 tolerance, which is pretty fascinating. So their bodies are getting more and more adjusted to the normal healthy levels of CO2 that they're just not used to. There's also something really cool that happens with nitric oxide. Nitric oxide is made in our nose, at least nasal nitric oxide. It's produced in our sinuses and in our nasal cavity, and it's part of our immune system. So when we breathe through our mouth, we completely bypass this whole function of our immunity. And so nitric oxide is antimicrobial, anti-inflammatory, antiviral. And when you breathe it in through your nose, it bathes your entire upper airway with all of those healthy properties. You mouth breathe, you don't get any of that. So that's one of the reasons why mouth breathers are more likely to get sick compared to nasal breathers. Also, I mean, we know that the nose is designed to clean the air, filter the air, add moisture to the air. But the nitric oxide component is also so important. And there is this, I pulled this, it's from a 2018 study talking about this hypothesis that mouth breathing leads to local inflammation, that leads to enlarged tonsils, and that leads to this, systemic inflammation and abnormal orofacial growth. And so it's kind of this vicious cycle that we get stuck in. And a lot of people think that it's the tonsils that cause mouth breathing. But what this is showing is it's actually the opposite. The mouth breathing leads to that inflammation and leads to the tonsils getting enlarged. In 2020, Dr. Zaghi added to this. He's a researcher at the Breathe Institute, and he said that tongue tie leads to low tongue posture, that leads to mouth breathing and abnormal orofacial growth. And that's what leads to sleep disordered breathing. So it's really fascinating once you understand this cycle. It's a vicious cycle, and it can be really hard to break some of these patterns, but it's not impossible. That's what myofunctional therapy is all about. I'm going to play this video that I found online. It's from Dr. Ben Maraglia, and he explains this whole thing super well. So let's hear it from someone else.
We're thinking about the tonsils and adenoids. Let's tackle those first. It turns out that early on, when the child begins to mouth breathe, it's the mouth breathing that causes the irritation of the tonsil and adenoidal tissue that causes its overgrowth. When the tonsil and adenoidal tissue gets overgrown or bigger and large, it makes the breathing worse. So the poor breathing brings the tonsil and adenoid size. Then the tonsil adenoid size makes your breathing worse. It's not that the tonsils started big and made your breathing bad. So they're not the start of it. They're the symptom of the poor breathing.
There we go. Just what I said. So it's helpful sometimes just to hear, quick video on it. All right. The last category, open mouth posture. Let's talk about this. And like I said, it's kind of the same thing. I mean, if your mouth is open, you're probably breathing through it. But there are some cases where people are actually breathing through their nose, but their mouth, they've just learned to rest in an open posture. This is a lot of times common with tongue-tied people. A lot of people who are tongue-tied, they don't have nasal congestion. They don't have allergies. They're just kind of resting with their lips apart, and that's it. I mentioned that when you mouth breathe and when your tongue is low, you have changes to your facial structure. And so these are kind of the common complaints that patients will often come to me with. I have a picture of Michael Phelps because he's kind of our poster child of myofunctional issues in the field. He's got all the changes, all, the narrow palate, the cranial facial jaw development issues. But he's an incredible athlete. So, you can't take that away from him. But here's some of the things. Now, I will tell you, as a myofunctional therapist, my focus is always health. I don't like talking about the cosmetic or aesthetic changes that can happen when you have that poor facial growth and development. But a lot of patients will come in asking about this, and I think it's important for all of us as providers to understand it. So I'll just read through the list: narrow palate, gummy smile, long face, flatter facial features, small lower jaw or quote unquote no chin, more of a vertical angle of the mandible, droopy eyes, low facial muscle tone, short upper lip, asymmetries, narrow palate or narrow smile, deviated septum or crooked nose, bump on the bridge of the nose, dark circles under the eye. So I have an image that this is taken from one of Patrick McEwen's books. And basically what it shows is if you're a child and you grow up breathing through your mouth with your tongue low and your mouth open, you're more likely to look like the guy on the left, okay? The not so great looking one. But if you're a child and you grow into an adult with your tongue up, your lips together, nasal breathing, you're much more likely to look like a good looking guy on the right. So again, I'm always trying to have the conversation around sleep and health and breathing and function, but there is a very real physical, visual, and aesthetic component to that I think, we just got to mention it. But I always have patients say, well, then what's ideal? What's normal? So anyone that we see that's considered to be attractive typically has really great jaw development, wide palates. They don't have long, narrow faces. They have more forward, broad palates. And they've got all of these people that, are considered to be pretty good looking. They have really good jaw development, facial development, and airway development. So they all probably breathe well and sleep well. All right, if you want to learn about any of these things I've talked about today in depth, I recommend these 3 books: Jaws, Breath, and The Evolution of the Human Head. All of these books talk about how these myofunctional issues are really very modern problems and modern health issues that only have really happened in the past like 200 years since George Catlin, or maybe 300 years. When we look back at skulls that are 5, 6, 7, 800 or thousands of years old, they all have these broad palates. They have all of their teeth. They don't have crooked teeth. They didn't need braces. They didn't need their wisdom teeth removed. And so we're trying to find out, why do all of us modern people have these small jaws that are causing these breathing issues, these narrow airways? Now we need orthodontics. And it all comes down to chewing and breathing well. So I think Breath is probably the book right in the middle. That's a New York Times best-selling book, and it's probably the easiest read, but the other 2 are also really fascinating. So if you want to take a deep dive and learn more about where did this all come from, I recommend these books. All right, let's wrap it up, and then I'm going to bring on a couple of my team members and we're going to answer some questions. So in conclusion, I've introduced you to the field of myofunctional therapy. So now you're empowered. Now I'm hoping that you can go from here and you can either, pursue more advanced training. You can talk to your patients about this. If you are a patient, maybe you can go seek out some help or do some more research on how to help yourself. I'm hoping that you can identify these symptoms in your friends, your family, your patients, yourself. I'm hoping you'll understand the goals of the therapy and what we're working towards and what we're not. And I'm hoping that you can see how these myofunctional symptoms create to these bigger challenges that we all face, either personally in our lives or in our patients that we're trying to help treat. So I'm going to, I think my slide's out of order. Where's my team? There we go. I wanted to say thank you from the entire MyoMentor team. We've got a great team. I've got a faculty that helps me teach. I'm going to have Jennifer and Ash come on and help me answer questions. Before I do want to just go back and talk about, if you do want to learn more, we have a 12-week course we offer 3 times a year. I have the QR code for it here, but we do it in January, May, and September. So we've got a September class coming up here soon if anyone's interested. Basically, we teach the class 2 nights a week. We've got group discounts if you want to sign up, with a team or with a partner. We have better rates when there's more people. And so if you're interested in a new career path, let us know. I'm also going to say, if you want something else, this is free. If you want some more information on any of these topics, we have a discovery portal that you can go into. I have lots of pre-recorded videos in there, informational content in there. So there's the QR code for that. The last one that I'm going to talk about is if you are a patient, or if you're a doctor or hygienist and you want to refer to someone, we have a map, if you go to this QR code, where you can find a myofunctional therapist who's part of our MMT program. That means they are committed to ongoing learning, ongoing education. A lot of them might be here, but these are our most committed therapists who we recommend that if you want to work with someone, they're vetted. We know how many patients they've seen. We know how long they've been practicing. We know all about them. And this is a really great way to find a therapist if you're looking for somebody to refer to or treat yourself. And here's the team. So what I'm going to do, I'll leave this up, and you guys are welcome to contact me through email. Go to the contact form on our websites, and let's bring on, I'm going to bring on not Molly, we'll bring on Ash and Jennifer. And if you guys raise your hands, I'll have you come on screen with me. Here we go. Okay, I see both of you. There's Ash and Jennifer. Perfect. Sorry, I'm a little slow with the technical stuff. I'm going to stop my screen share. Hey, Ash.
Hi there.
Hi. I think Jennifer's popping up. There's
Hello.
Jennifer. Welcome to the crash course. I know you guys have been there in the chat listening and watching the whole time, and I know you've been collecting some of the questions. So again, if anybody from this class has any questions, please let us know. We're going to start answering them now. So who's up first? What do you guys see?
I've got one here, and it's basically like a core question that we get asked a lot. It's from Rianne. She says, I'm a hygienist, and this sounds so interesting. Thanks. How can I get trained as a myofunctional therapist?
That is a great question. You know what? I think that we should have Ash and Jennifer introduce themselves, and then we'll answer the question. I should have said that first, but I was so focused on the tech stuff. So Ash, why don't you introduce yourself? Tell everyone what you do at MyoMentor, and we'll just do a quick little intro on that first. Then I'll have Jennifer go.
Sure. I'm Ash Kramer. I am the course director at MyoMentor, so I handle everything to do with our 12-week course and getting people signed up. I'd also say I think I do everything at MyoMentor, but that's obviously not true because my teammates and colleagues are amazing. So anytime you've got any kind of interest in getting trained as a myofunctional therapist, I'll be your first point of contact.
Mm-hmm. Ash does do a lot for us, right, Jennifer? So, but yes, you guys, if you are interested, he will be the first person to give you any information, ask you any questions before you're actually enrolled in the course. Which leads us to Jennifer, our graduate support extraordinaire. Why don't you introduce yourself, Jennifer, and then I'll answer that question because it was a good one.
So I'm Jennifer Rooney. I am a dental hygienist. I've taken the MyoMentor course, and Ash is your first point of contact, and I'm your next point of contact after you take the course. So helping out with graduate support. So any questions that you have afterwards, what do I do next? And we're going to answer some of those questions. But I'm your help person there.
Yeah, so Jennifer helps manage our study groups. We have study groups for our grads several times a month, and she's the point of contact for anybody who has questions after they take the initial training. So let's go back to that question. Read it again for me, Ash, because I got too distracted.
Sure. Rianne says she's a hygienist and she finds the field really interesting, but she's wondering how can she get trained as a myofunctional therapist? What's the process?
Yeah, so obviously we do training here. We're all biased towards our own training, the MyoMentor 12-week course. I think there's a lot of reasons why ours is the best program out there, and we can go into those. But there are, just so you know, there are several other training courses. The main thing that I'd recommend is, now that everything is online, I feel like online courses are very popular and very, like, everyone's doing online courses. I would really look into the background before you jump into a course. Look into how long has the person that you want to train with, how long have they actually been practicing, how long have they been teaching. I have unfortunately seen a lot of just pop up, like, hey, I'm teaching myofunctional therapy now. And I think that's important to know. The field is evolving. It's new. It's it's kind of overwhelming with the amount of information out there when you first get involved in it. So Ash, I'll turn it to you. Why don't you talk about some of the benefits of MyoMentor and our 12-week course? What do you tell people all the time when they ask you this? What do you say is different? What makes us different from other people?
I think that there's a few key points that make us different. One of the things I love most about the course is your focus on being up to date. It was Dr. Zagi who said that if you do one of his courses in 6 months to a year, a bunch of that information will be superseded by new information because the field is so new, so dynamic, and it's evolving so quickly. So I love the fact that you're constantly adding new content to the course and changing up. Anytime a new research study comes out, it ends up in there. Anytime we get a new protocol, it ends up in there. So that's really important. The other thing I think that's great is Sarah's figured out a long time back, you can do a lot of myofunctional therapy exercises. I mean, there are a bunch of them out there, but patients respond far better to fewer exercises done properly. So we don't teach every exercise known to man. Sarah teaches the key exercises and she focuses on having them done without any compensations in the right sequence. And patients get great results. Anyone who's a dental professional in here knows how difficult it is to get patients to floss. You
Yeah,
tell them they need to do myofunctional therapy exercise for half an hour twice a day. It's not
never
happening,
gonna
let's be
happen.
honest. So 5 to 6 minutes twice a day, very possible, very doable, and the patients get great results. And then the therapists get peace of mind. They actually are making a difference. And then I think one of the biggest factors for me, and it ties into another question that was asked, and I'll segue it straight to Jennifer, if you don't mind, is the support. You can do a course, you can do any one of a number of courses, but now you've actually got to go out there and start seeing patients and build your practice and learn. And the ability to actually reach out to someone who's going to get you an answer, either from our faculty or from the team here, is just so powerful. And Jennifer's that person. She has absolutely transformed our support. It used to be good. I think now it's exceptional.
Yeah.
We have grads who just are blown away by how effortless it is to get what they need in the process. So Jennifer, maybe you can talk on that for a second.
Yeah, I want to just elaborate really quick. The exercises we teach, we have 30 core exercises, and then we have, I don't know, maybe 20 additional exercises. And so that was one of the hardest things for me as a new therapist was I feel like I was given like 250 exercises and they were all kind of like different variations of the other. And it just felt like I was bombarded with information. I didn't know how to sort through it. So that's something I've tried really hard is to streamline and just teach like for me as a therapist, I want to be able to do the fewest number of exercises for the least amount of time to get the biggest impact because we all know, I mean, patients compliance is the hardest thing in dentistry in any therapy. And so how do you get there like short, sweet, fast, get in, get out and be super effective. So that is my goal. But yes, let's transition to Jennifer. What was the question? Somebody's asking about what happens after I graduate.
Someone did ask what happens after I graduate. Is there support and help available as I get started? And I thought that was a perfect sequence or segue from what I had said.
Yeah, go for it, Jennifer.
I think there's really three key elements that I do to support our graduates. And I see one of our graduates, Sandra Randolph, just commented about the support that she's gotten. So I just kind of wanted to throw it out there. If we have any other graduates in there, if you wouldn't mind mentioning kind of some of the things you've experienced in taking the course, that would be great for people to read. But one of the key things that I do are graduate office hours. So twice a week, I have 1 hour where you can pop into a Zoom call just like this and we can have a face-to-face conversation because sometimes questions are complex and much more complex than we can answer in a simple email. So if we can have a conversation, I can know what you're up against. We can devolve and evolve in that conversation as we go. So that's available. We also have a digital manual. So Ash was mentioning how things are constantly updated. That digital manual lives on our platform for you to go back and reference. So we've got things like business forms, clinical assessments, our therapy manual, all the different research. So as research is coming up, we've got that broken down by about 12 or 15 different categories, and each category probably has another 15 to 20 research articles. So that's always updated and maintained and access to you as a graduate. And then Sarah mentioned about finding a therapist. We also have an advanced membership program called the MMT, or the MyoMentor Myofunctional Therapist program, which I support. So if you really want to take your education and your learning to another level, that's available to you as well.
Yeah, thank you, Jennifer. I see a couple questions in here. I'll go to, let's look at Namrata. They say how to start with a 3-year-old child who's mouth breathing. So whether this is for your child or for a patient you're thinking of, I think it's a good question. 3 is tough. And so I think go back to that slide where I said, is it a tongue problem or is it a nose problem? And the best thing you can figure out with a 3-year-old is why are they mouth breathing? Like what's going on? So if they're nasal, if they're congested, then we have to start asking, do they have allergies? Is it food sensitivities? What's causing that inflammation? Do they have large tonsils and adenoids? So start to kind of investigate which path you need to go down. Myofunctional therapy technically starts, it's like age 4 and up. We can do exercises with young kids, but we call it more of a mini myo. It's not a full program. I would also look for a speech pathologist who's trained in myofunctional therapy because they might be able to assist with maybe feeding therapy or oral motor therapy in addition to the myofunctional training. So, but first, just as that provider or parent, start asking, is it a nose problem or is it a tongue problem? And if you find a dentist who specializes in tongue ties, they should be able to help you determine if it's a tongue tie. So, or a myofunctional therapist. What's next? Jennifer, do you see another question on there?
I do. Alyssa's got a really good question. She says, for time zones that are different than Pacific, that makes the course less beneficial. If you can't attend live, how do we manage that in our course?
Oh yeah, I mean, we can talk about this. It's every single thing we do is recorded. It's put into the online platform. I mean, I always tell Ash he doesn't need to be so, fanatical about it, but he literally, as soon as the live course ends, he waits for it to download and he goes and he uploads it to the online platform so that like people who want to watch it early in the morning the next day can do it. So I appreciate his effort. I always tell him he doesn't have to do that, but he wants to do that for all the students. So, but yeah, the whole thing's recorded. We do have people in, South Africa or in Australia or in Europe, and so the time zones don't line up, and they have to watch a lot of the recordings, and so we do make it so if you have to do that, it's available. Obviously, I mean, I do the course live. I teach it twice a week, and there is something about if you can join it live, that kind of we're all here together on a Monday night or a Wednesday night. So if you have the ability to, it's always better. But we're all busy too. So if you have a kid's soccer game or you have to go to some dinner event, you can always come back and watch later.
There's another question here that's actually a really good one. It's from Lexi Hannah, and it's kind of a longer question. So what I'm going to say is, Lexi, please feel free to email me at ash@myomentor.com, and I'd be happy to have a chat or to answer you by email or text, whatever works for you. But part of the question is, do you think it's realistic to balance dental hygiene and myofunctional therapy at the same time? Maybe seeing myo patients 1 day a week. Absolutely. One of the things I love about myofunctional therapy is that it's so flexible, especially from a hygiene perspective. You can do it live, sort of in the dental office or in a private practice. You can do it virtually. You can do it as a combination of them. Many of our grads will start off exactly that way. They'll start off doing myo in their day off or their morning off a week and slowly build their practice while keeping up their hygiene hours. And as their myo practice grows, they'll back off on the hygiene days, and eventually, without any real pressure, they end up running their own business. So, yep, it can definitely be done. But like I said, feel free to reach out to me, ash@myomentor.com.
Thanks, Ash. I see Evelyn, and I know there's another question. Evelyn is asking, is there a certification? Which is a great question.
Great question.
Who else had the question on certification?
Erica asked earlier, she specifically mentioned the IAOM website.
Yeah. Yeah. So we work closely with the IAOM, which is the International Association of Orofacial Myology. Our course, the 12-week course, qualifies to go through the certification process through the IAOM. We love the IAOM. We funnel like anybody who wants to be certified after they graduate from our course. It qualifies you to go take the certification. It's getting more and more like a board exam. It didn't used to be, but again, our field is evolving. Things are, it takes time to get things to be more like legitimate, right? And so now we have the IAOM, who is our certifying organization. I will say there are other organizations who also offer a certification when you're done. I've always hesitated to do that because I just feel like I don't really want to give you a certification just because you completed my course, but you do get a certificate to say you graduated, you got the training, you can hang it on your wall. And then we also offer CE for dental, and we're working on physical therapy CE. Speech CE is a little different. Ash can talk about that because he's the expert, but you can get a CE for the 30 CE credits. You can get a CE certificate and a graduation certificate. And then you can go on and get certified through the International Association of Orofacial Myology. And that's just a different path. You do not have to do that. As soon as you graduate from our 12-week course, you are a myofunctional therapist and you can go out and see patients. And so it's really that simple. But you know, a lot of people do choose to do the certification if they're interested in that. Does that answer it? Let me know in the chat if that sounds clear, because I know there's so much confusion around that online. So what other questions do we have?
I've got a good one, and this comes up a lot. Annette asked, if I take your course, can I start seeing patients right away, or will I need more training? So she's not asking about certification. She's thinking, do I need an advanced course, or do I need multiple layers of these courses before I'll be comfortable with patients?
I mean, in theory, no. You should just be able to come right out and practice. And that's also why we have so much graduate support, because a lot of people feel nervous. They don't know, you know, they're kind of like, oh my gosh, like how, it's just that they don't have the confidence. They have all the skills, all the training, all the knowledge, but sometimes we need a little bit of confidence building. And that's, I think, really what Jennifer's so good at. It's really helpful to come, if you have your first patient, come to a study group. We've got 4 faculty members. They all host a study group once a month. We've got Dave, Melissa, Dr. Bell, and Tiffany. Tiffany is a speech pathologist, so she teaches, her study group is all about speech and myo. Dr. Bell is a general dentist, and so her study group is all about dentistry and myofunctional therapy. And then Dave and Melissa both have their own private practices in myofunctional therapy, and they have unique backgrounds as hygienists. And so they've got study groups. And so between all of us, we have amazing support to help guide you through. After you graduate, you should be ready to see patients no matter what. But if you don't feel ready, then we've got, lots of people to cheer you on and help you get going.
I'm going to add 2 things to that. So she mentioned Dave. He's our newbie resident. So when
Yes.
you are a new grad, he has a study group specifically for new people, and he
Yeah,
really
it's called the
tailors
newbie study group. I forgot that.
what he does to that. And then, they're in those study groups. When you come on, it's kind of like this platform. We just answer questions that come up. Sometimes we have a guest speaker. There is so much additional content that you learn about in those study groups. So it's like your education continues, and those are free for graduates to attend live. So that learning can continue as much as you want to attend those study groups. And, it works out to be like between 5 and 6 hours a month of additional learning opportunity.
Great point.
That's free. So.
I just want to read Sandra's comment because I just saw it. So thank you, Sandra. She says, I took the course in May 2024. It exceeded my expectations, and I would recommend to anyone considering. Also, after you graduate, there is so much support. It doesn't just end with when the course is done. Thank you, Sandra, for that comment. That's really nice.
I love hearing that kind of thing.
Yeah, I see there's a couple people asking about specific things. Sally says, does the appliance that forces your tongue to the roof of your mouth versus pushing your tongue against your teeth work? Yeah, so we call those tongue cribs or tongue rakes. Some orthodontists will put in this kind of a contraption that goes behind your teeth so your tongue doesn't push forward in tongue thrust. It doesn't touch the teeth. And I will tell you from a dental perspective, this does help the dentist be able to straighten the teeth. From a myofunctional muscle perspective, it does not change anything. So you don't learn how to breathe through your nose. You don't learn where to rest your tongue or how to swallow in the correct way, but it will help the dentist or orthodontist straighten your teeth. I'm not going to lie about that. It just is not, it's not probably going to be a long-term habit change of all of the soft tissues, the tongue, the lips, the breathing. And so over time, once that appliance is out, there's a pretty high chance that you might have some movement or some relapse in your teeth. So just be aware of that. But yeah, the appliance works for what it's designed for. It's not designed to change habits or function. It's just designed to keep the tongue away from the teeth so the teeth can get put into the right position. What's next?
I've got another good question that kind of follows up after the course. Miranda says, I'm a hygienist. Can I do myofunctional therapy in my own practice, or does it have to be done in my doctor's office?
I think it depends on your state, but the majority, I think 99% of all the states, you are allowed to practice independently. And it's, you know, it's kind of, again, evolving, but the majority of us, like me, all the people on the team, a lot of the people who take the course, they are practicing and they're starting their own businesses and they're got independent practices. I would say there's a very large percentage of hygienists that are now practicing with a dentist as a team, which honestly, to me, in the perfect world, I do think that is one of the best ways to deliver complete patient care is if you've got the dentist who can do the orthodontic or the tongue tie or the airway sleep disorder breathing treatment, working like hand in hand as a really great team with the hygienist doing therapy. Um, that's amazing. And I think that's actually the best case scenario. But unfortunately, a lot of dentists, they don't know about this. Maybe the hygienist is the one that knows about it. The dentist isn't really that interested in it. Um, or they just rather refer than have it in-house. And so there is a need for both and there's a place for both. But I think, Ash, what is the one state where you can't, is it New Jersey where you can't, you have to practice with a dentist? I can't remember.
I don't even know if there's one that's got any direct regulations yet. They're still working through it. I think New Jersey had some conversations going on.
Mm-hmm.
It's also just evolving, the same as the field is evolving. The
Yeah,
various states are making changes very, very quickly. So it's a dynamic field.
it
We
is.
always
Yeah.
suggest reach out to your state board and find out exactly what they're currently saying. And remember that in 6 months, it might be different.
Yeah, so true. So, and you just, that's one of the reasons it's nice to attend the study groups because as we learn things,
Yeah.
I'll be able to share that with all of you. So, okay, what's next? I see there's some questions in the Q&A box. Do you guys see any others? We'll go on
Let's
for
see.
like 7 more minutes and then we'll wrap it up.
There's one that always comes up, and I get it a lot, obviously, as I'm speaking to people about changing their career path. It's from Mandy. She says, I live in South Dakota and I'm considering becoming a myofunctional therapist. I'm wondering how much money I can make and if this can replace my hygiene wages.
Yeah, it's very practical. Tiffany is actually from South Dakota. She's our faculty member speech pathologist. And so anyway, but I think, I mean, it's kind of, you know, the sky's the limit. So we have, I can just tell you the pricing. So myofunctional therapists can charge anywhere from $100 a session to $200 a session on average. I mean, we definitely see people charging more. Sometimes we see people charging more like 75 or 80 a session. And the minimum, I would say, or minimum to average number of sessions people need is 10 to 15 sessions where we're looking right in that range. And so when you kind of do the math, if it's 200 and you need 12 sessions, that's $2,400 for that therapy program. And then you can think, okay, well, if I started 3 patients a month and that's $2,400, you might not collect it all up front, but you could start to see how even on like a payment plan over a couple months, you can start to kind of run some numbers and figure out, you know, when could I replace the hygiene? If you're working 2 days a week as a hygienist, I think it's pretty easy to replace pretty quickly. You know, if you're working 5 or 6 days full time, obviously it's going to require more patients, but you can start to do the math and look at the numbers. Now, of course, that's talking like gross revenue, right? Like 10 patients is going to bring, you know, at that number, $24,000. Well, there's still your time and there's still supplies and there's still maybe an office to rent and you have kits to send out or to give to your patients. So that just can give you like an overview of the financial side of it. But I mean, that's a great question. And then you just have to kind of figure out like in my area, can I charge 200, 150, 225? You know, that's I think the best way to think about it. Evelyn's asking about insurance covering any of it. Unfortunately, this is not a field that is covered very well by insurance. It's done through medical insurance, not dental. And it's getting better, but it is still not great. So we typically talk about giving a super bill and then having patients submit that super bill to their insurance company. Some of us bill insurance directly. I don't. It's just, there's so much to it. But I mean, you can. A lot of times the speech pathologists who do this, they already have the setup to do it, and it's a little easier for them. What else can I say about insurance? Pretty much it. I mean, I think that's also changing. So, we're hopeful that we can get more insurance. But what we do at my practice is when we see patients who really, really have a financial need, we can offer discounts. We can offer, more spread out payment plans or scholarships. So there's always this, challenge around access to care. And this is considered, I mean, it's a first world expensive thing, $200 a session is not cheap. And if insurance doesn't cover it, I mean, it's a very expensive treatment for a lot of patients. They just can't afford that. And so there are ways to make it work, but right now it's just one of those challenges that we all face. So what else?
Caitlin's got a good question. She says, as a hygienist considering myofunctional therapy, do you recommend oral appliances such as MyoMunchie to help with certain patient therapy?
Yeah, definitely. We love MyoMunchie. We recommend it. I kind of think of it as like a gateway appliance, like that old expression, like a gateway drug, where you can like lead people into therapy by trying something like that first. So they might be like unsure, or maybe they don't want to pay for it yet. But if you offer them some tools and some things to try on their own, they're helpful and they can just stay there. Or they can say, maybe I do actually want to work with a therapist, and like maybe it can actually lead them into therapy. So.
Or sometimes we integrate those tools into the therapy.
Yeah, no,
There's
that's true.
various things. And so one thing might be better for one patient than another. So the therapist will make a guided recommendation.
Yeah, we love working with the other products and companies. Jennifer, you want to talk about some of the other companies that we work with, and what products we don't necessarily say that you have to use them all, but we talk about them as really great resources and tools.
Yeah, there's the Spot Pal, which is a custom fit appliance that helps with tongue spot positioning. There's the Replenish Mile Nozzle, which helps strengthen the posterior part of the tongue for tongue up posture, came on market for snoring. There's something called Greco Gum, which is a mastic gum to work on chewing. We mentioned the MyoMunchie. There's also Myo Tape by Patrick McEwen that goes over the mouth with an opening in the front. So mouth taping to help with mouth closure, but still letting you have an avenue to breathe. And so we have a resource that we get to graduates called Tools to Support Myofunctional Therapy. And so we often collaborate with these companies to offer promotions to our graduates to obtain those tools and resources more economically. And one more comes to mind. It's called Myo Made Easy. And so when you are a myofunctional therapist, that is a resource to be able to source your kits for your patients, and this is getting a little deep, but you could also send the patients there to order the kit so you don't have to take on that extra overhead of supplying that. So.
Yeah. So I think there's so many great tools out there. MyoMunchie's one of those as well, but since you already mentioned it, then yeah, worth repeating. Well, we've got about 2 minutes and we'll wrap it up. Are there any last questions here? I see Sally, she's asking about her son. My son is 16, has braces, now discovering after a shift in his bite and his jaw development that he has been mouth breathing. Saw an ENT who has him using a nasal spray and mentioned a deviated septum. I found a local therapist who does myofunctional therapy, and he's seeing her in July. Is the bite correctable with therapy without having to invest again in braces? I'm not going to give you a yes or no because I haven't seen him and I'm not sure, but I would say, if he can get the tongue, the breathing, the lips, and all the muscles and soft tissues under control, there's a chance that definitely that he won't get worse. He might just stay right where he is, or I mean, maybe depending on what's going on, maybe he can avoid braces in the future. But I'd have to kind of see and actually interact and look at what's going on. But I'd say there's a small chance. But at the bare minimum, he's going to stay right where he is. And so, maybe braces can come down the road when he's older if he's really against doing it again. But yeah, that's my answer. So, and then Melody, or did you want to read a different one?
I just was going to make a comment. Valerie made a comment in the chat. She says her daughter is currently in one of our courses, and after watching the presentation, she can say she's going to be asking for a family discount. And I just wanted to just kind of mention the realization and the eye-opening experience that a talk like this can be. I've been a hygienist. I'm going on, I think, my 33rd year. And I learned about this about 3 years ago. And I always say, I never thought I'd learn something so transformative this far into my career. So if you're sitting there and your mouth is open, well, close it, number one. But, it's just, you can go down the rabbit hole and it really is completely life-changing.
Yeah. Well, that's a
From
great
both a
note.
patient and a provider perspective. So
For sure. Yeah. I mean, as a career path, as a business, idea to go down on your own, definitely like the transformations that we see in our patients, Jennifer, I appreciate you saying that. And I think it's a great note to wrap it up on. We've been going for an hour and a half, and I know people have things they'd like to get on in their day. And so thank you everyone for joining. Thank you, Ash and Jennifer, for coming on and answering those questions. Thank you to everyone who submitted questions. And please feel free to reach out to us. The email is easy. It's either Sarah@MyoMentor, Ash@MyoMentor, or Jennifer@MyoMentor. So we're happy to help. We're happy to point you in the right direction. If you're a patient, you're looking for a therapist, don't hesitate to reach out. If you're a provider and you want to know more about our courses or training, please don't hesitate to reach out either. All right. Thanks, everyone. Have a great day. Bye.
I know.
Bye, everyone.